Hello everyone, I'm Anas Al-Ubaidi, and the title or the topic for this session or lecture is Patient Confidentiality Beyond HIPAA. So, patient confidentiality beyond HIPAA within the chapter that covers the foundations of excellence in healthcare administration within the Certified Medical Administrative Assistant course program by ACMSO. So let's start. Introduction. Patient confidentiality is one of the cornerstones of ethical and legal practices in healthcare. While HIPAA, which is short for Health Insurance Portability and Accountability Act, and this applies in USA as an act to protect the personal information or the personal data, and for each geographical area or each country, there is something relevant or parallel that works like HIPAA. For instance, in European Union (EU), we have the GDPR, which and GDPR it is short for General Data Protection Regulation in European Union. So HIPAA serves as the federal standard for safeguarding protected health information (PHI) confidentiality reaches far beyond compliance with regulations, especially in today's data-driven healthcare environment where technology is rapidly evolving. So the principles of patient privacy demand a deeper understanding. So key points. Let's start with the key points as here we'll start with HIPAA and its limitations. And before we start, we have here a descriptive diagram showing the privacy and security in healthcare, as we have the four quarters: accidental over here with control measures, accidental over here without control, intentional breach without control, and PHI, personal health information or patient health information breach with intentional access controls. And here we have high control, low intentionality, low control, and high intentionality. So HIPAA and its limitations, what does HIPAA cover? HIPAA is primarily concerned with the protection of PHI, personal or patient health information, ensuring it remains secure when electronically transferred, stored, or shared. It stops unauthorized individuals from accessing patient records and mandates accountability for breaches. What does HIPAA not address? HIPAA focuses on procedural compliance but doesn't account for subjective aspects of privacy, such as accidental conversations overheard in public spaces or ethical dilemmas in sharing anonymized data for research. I.e., in other words, a healthcare worker discusses a patient's condition in an elevator. Although this violates ethical privacy standards, it may not always breach HIPAA rules, as it depends on intent and access controls. Another key point here: ethical dimensions of patient privacy. Principles of autonomy and trust. Beyond the legality, respecting patient confidentiality preserves their autonomy. The right to control who accesses personal information, establishing confidentiality, also fosters trust without which effective care cannot occur. In other words, or for instance, a patient hesitates to disclose critical details about their condition out of fear that personal data may be leaked. Balancing privacy and public good, sometimes administrative professionals must weigh privacy against societal benefits. For instance, reporting communicable diseases to authorities while safeguarding sensitive personal data. And here is a diagram on how should patient privacy be managed, respect autonomy, and balance public good, or balancing public good. Another key point here, growing challenges in the digital age. Cybersecurity risks. The digitalization of medical records has increased the risk of cyber attacks. Administrative staff must understand encryption standards, multi factor authentication, and incident response protocols. For instance, uh, ransomware attack locks an organization's EHR, electronic health record system. Professionals trained in HIPAA may know the reporting obligations but might lack proactive cybersecurity measures. Overlap with emerging technologies. Wearable devices, telemedicine, and mobile apps collect vast amounts of patient health data, often outside the strict bounds of HIPAA covered entities. And here's a diagram showing or a diagram on navigating digital challenges in healthcare. Regulatory compliance expert, untrained staff, cybersecurity focused team, proactive cybersecurity team. Another key point here, the role of administrative professionals acting as gatekeepers. As administrative medical assistants, oversee access to patient files, misplacing files, mishandling shared drives, or granting improper permissions can compromise security. Building awareness, they have the responsibility to educate teams about common pitfalls like clicking phishing links or discussing cases in unsecured areas. Global perspectives on data privacy. Healthcare is international. With telehealth and multinational collaborations, laws like GDPR, General Data Protection Regulation in European Union, intersect with HIPAA, necessitating an expanded understanding. For instance, a US provider of offering virtual consultations to European patients must adhere to GDPR rules, including explicit patient consent for data storage in USA. So in this example, we showed that although it's a US provider, but this US provider has to comply and follow the EU data regulations, which is GDPR, because because this provider is offering consultations for European patients in European Union area, where the GDPR rules over there. So the data regulation or the Data Act will coordinate or collaborate or be wherever the patient is stationed or located, the geographical area of the patient. Application examples. So, implementing secure communication channels. Scenario here, a clinic uses unsecured email to send appointment reminders and follow-up care instructions. This leaves patient communications vulnerable to interception by unauthorized parties. Solution, transition to encrypted communication tools, such as HIPAA-compliant messaging platforms, for instance, MyChart or Tiger Connect. Use two-factor authentication, 2FA, for both patients and staff to secure access to communication portals. Limit the details included in appointment reminders, for example, avoid mentioning sensitive health information. Resources and tools, training for staff on encryption tools and compliance-focused email practices, pre-drafted templates for secure message communications, IT support for implementing 2FA, which is two-factor authentication infrastructure. The outcome here, patients receive secure communications, reducing risks of unauthorized access while improving trust in the organization's privacy practices. Number two, we have here auditing rule-based record access. Scenario here, a data breach occurs when an administrative staff member accesses records beyond their job scope, exposing sensitive details they were not authorized to view. Solution, conduct routine audits to monitor access logs in EHR systems. Implement role-based permissions, ensuring staff can only access files relevant to their responsibilities. Provide regular reminder and updates about data access protocols. Resources and tools, audit software tools like Fair Warning or Splunk for automated tracking. a permissions matrix to document and control authorized access, routine team walkthroughs of appropriate access permissions. Outcome here minimize risk of internal breaches, ensuring patient records remain confidential while fostering accountability among the workforce. Creating privacy zones. Scenario here reception staff frequently discuss patient appointment details in open waiting areas. This results in an uncomfortable situations where other patients overhear sensitive information. Solution designate confidential areas for discussing patient related matters, for instance, private cubicles or soundproof rooms. Introduce background noise machines in open environments to mask conversations. Train staff to use low tones and avoid verbalizing identifiable details in public settings. Resources and tools, environmental assessments to identify ideal zones for private conversations, noise masking devices like white noise machines, privacy specific communication scripts for reception staff. Outcome here improved privacy for patients, leading to increased satisfaction and reduced risk of inadvertent confidentiality violations. Another example here, implementing automated printing safeguards. So scenario here, a shared office printer accidentally outputs PHI visible to multiple employees, creating a potential data breach situation. Solution, require PIN authentication for staff to retrieve print jobs from shared printers, enable print release functionality that allows users to collect documents securely, periodically review and purge printer memory to prevent retained sensitive data. Resources and tools, secure printer systems such as HP Secure Pull Print. Example, employee, as just for example, the HP one. Employee training on PIN setup and retrieval processes, IT monitoring solutions for printer activity. Outcome, stronger control over printed materials, ensuring documents with a PHI are only accessed by authorized personnel. Another example here, regulating mobile health apps. Scenario, patient use third-party health tracking apps that sync with the clinic systems. But many apps sell health data to advertisers, posing ethical concerns. Solution here, evaluate and recommend only HIPAA-compliant apps to patients. Provide clear guidelines to patients on secure their health data independently. Inform patients about the risks of data sharing settings on third-party apps. Resources and tools, a vetted list of trustworthy apps. For example, MyFitnessPal, Apple Health with health data protection, workshops educating patients about secure usage of mobile health applications, clinic IT integration, policies that limit sensing to secure or synchronizing to secure platforms. Outcome here, patients are more informed about data privacy in health apps, safeguarding their PHI while enhancing their trust in the clinic's technological recommendations. Enhancing telehealth security practices. Scenario, a telehealth platform improperly stores video call recordings without encryption, leaving PHI susceptible to breaches. Solution, transition to HIPAA-compliant telehealth software, for example, Zoom for Healthcare. Disable call recording features unless explicitly needed and ensure all recordings are encrypted. Standardize privacy training specifically for telehealth sessions, including the importance of locked private rooms during video calls. Resources and tools, software platforms verified for HIPAA compliance, encryption tools to secure recorded sessions, user manuals for patients to conduct secure telehealth sessions on their devices. Outcome, telehealth becomes a secure and more reliable mode of care delivery, reinforcing patient confidence and sensitive discussions during virtual visits. Monitoring third-party vendor compliance. Scenario, billing vendor mishandles PHI, emailing invoices with unsecured patient data to unauthorized recipients, leading to trust deficits. Solution perform compliance audits for vendors handling PHI, ensuring they adhere to business associate agreements (BAA), establish contractual penalties for privacy violations, irregularly review vendor data sharing processes to guarantee confidentiality. Resources and tools, pre-developed BAA templates for legal compliance, risk assessment tools to evaluate vendor privacy practices, periodic vendor questionnaires focused on security standards. Outcome here, vendors meet high privacy standards, preventing mishandling of sensitive information and maintaining reputation integrity for the clinic. Conducting routine phishing simulations. Scenario here, employees fall victim to a phishing scam, inadvertently sharing login credentials, which leads to compromised patient data. Solution, launch phishing awareness training to educate staff on recognizing attack patterns, conduct routine simulations to test the team's response to phishing attempts, implement multi-factor authentication to reduce risks even if login details are compromised. Resources and tools, anti-phishing resources such as KnowBe4 simulation platforms, email filtering programs like Proofpoint, monthly team reviews emphasizing lessons from simulated attacks. Outcome here, a workforce better prepared to identify and resist phishing attacks, significantly reducing the likelihood of data breaches. Training for cross-border privacy compliance scenario. A patient from the European Union (EU) receives care, but the clinic inadvertently misuses their data by failing to meet GDPR guidelines, since GDPR applies to EU area. Solution, train healthcare staff on global privacy laws, including GDPR and HIPAA, assuming that the healthcare facility based in USA. Establish universal protocols and meet the strictest applicable regulations. Create separate workflows for handling international patient data. Resources and tools, GDPR compliance manuals tailored for healthcare organizations, training materials comparing HIPAA and international privacy laws, cloud storage solutions with global privacy encryption standards. Outcome, fewer compliance breaches, improved patient confidence, and readiness for international care delivery. Strengthening anonymized data research practices. Scenario, a research team anonymizes data for clinical studies but leaves indirect identifiers, for example, zip codes that may re-identify patients. Solution, use advanced de-identification techniques, removing or masking direct and indirect identifiers. Appoint a data privacy officer to oversee research data use. Require robust consent forms from patients outlining their data's use even when anonymized. Resources and tools, software like HITrust, for advanced de-identification. Templates for patient consent specific to research participation. Regular compliance checks conducted by privacy officers. Outcome here, data remains secure while enabling meaningful research, ensuring compliance with ethical and legal standards in data handling. Summary tables. Here we have table on HIPAA and its limitations, table on ethical dimensions of patient privacy, table on digital age challenges in data, table on rules of administrative professionals in patient confidentiality, table on application scenarios and proactive. Next, we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. Which of the following best describes the limitation of HIPAA concerning patient confidentiality? A, focuses exclusively on paper records. B, covers only verbal disclosures of PHI. C, doesn't address data privacy in international contexts. Or D, includes all health data breaches globally. One of the limitation here would be C, of course, does not includes all health data breaches globally It's quite the opposite, as it's C, as doesn't address data privacy in international context. As for the same example we have mentioned, US-based provider providing consultation for patients who are EU, European Union based. And here, the provider, they and the staff, the facility, the whole facility staff needs to be aware about the GDPR that applies into the EU patients. So C would be the answer. HIPAA is US based and doesn't encompass privacy regulations like GDPR in international contexts. Question 2. What is an effective proactive measure to prevent unauthorized access to shared office printers containing PHI? A. Remove all printers from shared office spaces. B. Use printers with print release functionality. C. Encrypt email sent before printing. Or D. Store printed documents in filing cabinets immediately. The answer is B, as printers with print release functionality require user PANs or authentication to retrieve print jobs, ensuring only authorized users access sensitive information. Question 3. Which principle of ethical privacy focuses on ensuring patients can make informed decisions about their data? Is it A, beneficence, which is about the benefits, B, transparency, C, cultural sensitivity, or D, trust? So, which of the four applies into the ethical privacy focus, that is, focusing on ensuring patients can make informed decisions about their data? I would say transparency, B. Being transparent, of course. Once you are being transparent, you'll give the opportunity for the patient to decide on themselves um, um, wisely, since they'll have the whole picture or the whole understanding because of the transparency that came from the transparent method or approach that the staff applied, or the staff member applied. So B would be the perfect answer, as transparency involves clear communication about how data is used and stored, enabling informed patient decisions. Question 4. What is a common digital age challenge impacting patient confidentiality in healthcare? A. Limited understanding of HIPAA by legal professionals. B. The increasing complexity of medical diagnoses. C. Cybersecurity threats like phishing attacks. Or D. Excessive time spent training medical specialists. C would be the answer, as cybersecurity threats such as phishing attacks are a significant challenge, often leading to breaches of sensitive patient information. Question 5. Which administrative rule emphasizes implementing rule-based access control to EHR systems? A. Technology enforcer. B. Privacy advocate. C. Gatekeeper of records. Or D. Global compliance learner. The answer is C. Gatekeeper of records. The gatekeeper of records ensures only authorized individuals access specified PHI through rule-based access controls. And here we come to end of this lecture. Thank you very much and goodbye.